the guest. We're all related. Just wanted to make that point here. Just because, because of what's happening in the past few weeks, we haven't seen each other for a while. So for example, Dr. Sharief, we call him Awais Bhai. He's actually my brother-in-law. So I haven't seen him since, I don't know, for the past few months. He, alhamdulillah, he had a new child, and we haven't even gone to see the new baby either. Samir, he's also my brother-in-law. I haven't seen him in 2, maybe 3 weeks. And Dr. Abdur-Rahman, he's my brother. I haven't seen him in months. He's living the resident life, basically sleeping on the floors and so forth. But that's just a brief introduction of who they are. Samir, he had a few points to mention before we kind of go into this conversation. Samir, why don't you go ahead and say what you got to say.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Allahumma salli ala Muhammad wa ala ali Muhammad kama sallaita ala Ibrahim wa ala ali Ibrahim innaka Hamidum Majid. Just wanted to start off, I will let Awais Bhai, I call him Awais Bhai, Dr. Sharief. He's also a brother-in-law of mine. So we're all related, as we said. And he'll start with a disclaimer, but I just wanted to thank Dr. Abdur-Rafay to invite us and host us for this extremely important information that we're trying to disseminate here. So we agreed to do this program to deter Muslims in specific, especially Muslims here residing in America, from consuming or propagating misinformation or disinformation, and to dispel rumors essentially about coronavirus and what we need to do now. So that's the most important thing. All the stuff we're hearing, all the stuff we're consuming, I think it's important for us to block some of this stuff out, because it's a lot of noise from a lot of people who don't know much and are just dispelling rumors. And we don't want to propagate that, because that could essentially affect lives and put people in harm's way. Preferably, I'm trying to speak on for myself first, but I'm sure Dr. Sharief and Dr. Syed Abdur-Rahman, they'll agree with me, is that we don't want to discuss who is to blame and play the blame game now, because essentially it's not going to help at this stage. That could probably be done at a later point when we have to look back. Inshallah, we get a chance to look back and learn from this. This is meant to be an informative as well as an educational service for all of us, and to unite all of us from the public health sphere to the professional health sphere, and from the spiritual sphere, all unite together to the same common cause. Finger point at this juncture is no way beneficial to anyone. And with that, I'll let Dr. Sharief make a disclaimer about the medical advice we're going to give here.
Assalamu alaikum everyone, and Jazakallah khair to everyone, Samir, Rafi, Abdur-Rahman, for taking this initiative. And exactly as Samir said, the goal of this was basically to filter the noise online, and there is some truth as well as a good amount of misinformation circulating online. So basically, especially from a Muslim standpoint, we need to have a bit of a different perspective on this. So if inshallah, if whatever we can do, inshallah, we are more than happy to do it as a quick Q&A session, as well as before that as an informational session. But as with any medical information, I mean, each one's individual situation can be a bit different. And any information we are happy to provide, but at the same time, you have to consider individual situation, and if anyone needs help or something, more than welcome to contact me or Samir or Abdur-Rahman or Abdur-Rafay. But at the same time, don't forget your primary doctor as well as the healthcare team. So if you think you need help, please don't hesitate to get help from your primary care doc or your healthcare team. So, okay. But at the same time, during this session, as well as even after the session is over, inshallah, I will send my phone number, and if anyone has any questions later or something, yourself or anyone, you are more than welcome to get in touch, inshallah.
All right. Jazakallah khair, guys. Appreciate the disclaimer. So just to let our audience know that we will be having a Q&A session at the end after we discuss a certain few things, so that we come up to speed to this disease and how we tackle it and so forth. So if you guys have, if anybody who's joining us, if you guys have any questions, you can either just type it into the chat message on your right, and I will read it out to our guests here, and they will inshallah answer it the best they can. Like Dr. Sharief said, if you guys need personal information, I will be, the participants are willing to share their information. If they need any sort of advice, inshallah, they'll help out the best they can as well. So let me start with you, Dr. Sharief. Let's just start from the basics, just so that the lay person knows what this is. So if you could just kind of tell us, what is this virus and why is it so different than, let's say, a flu virus that typically we're familiar with?
Right, inshallah. So basically, viruses are very, very sub-microscopic particles. I mean, like even the bacteria is very small. You can fit like 1,000 to 1,000,000, depending on the type of a virus, into a cell. So basically, the majority of the viruses are only seen by the electronic microscope. But they survive only inside a living object. And viruses don't just affect humans, but humans, animals, but even plants. There are different types of viruses. So there is a natural host for a variety of viruses. The majority of the host, when it is a natural host for it, nothing happens. But when the viruses move from one normal host to a different, sometimes they replicate and mutate and causes a problem. So the same goes for not just for the viruses, but for bacteria too. So in summary, coming to this corona thing, well, in Southeast Asia, especially in Thailand, Vietnam, China, some parts of, that part of the world, there is a bit more closer interaction between humans and livestock. Right? Mm-hmm. It's part of the culture, that's perfectly okay. And so every year during the winter time, there is always some local epidemic which happens in that area. Mm-hmm. But majority of the years, nothing happens. But this time it got a bit out of control, so to speak. So this happened literally like 4.5 months ago, around mid-November, around that time. So one of the shop person who used to deal with the wild stock, especially, I mean, there is a good suspicion that it may be coming from bats. So the bats are a normal host for it. But
so let me just hold you off on that 1 second. So you're going to say this because it's been floating around on all these people sending WhatsApp messages in the media, etc. And this idea that somehow people ate bats and hence it came from there. Now, do you want to speak about that a little bit, just so that we are clear of how is this true? Is this something that is confirmed? Is it something that just a rumor going around?
I would say a good part of it is rumor about eating bats, but there is a closer interaction, no doubt about it. I mean, even without eating, I wouldn't say would play a part, but it's just a closer interaction with the humans and the livestock over there. So a small amount of local epidemic happens every year, and that's normal. It's well contained. But this year it just went out of it because of the travel or whatever, and this is where we are at this time. And yes, this is different from flu. The reason because flu has been there people have studied flu for more than a century. And there's a good amount of herd immunity for the flu. And yes, the number of flu cases are still by far much greater compared to the corona. But at the same time, we don't know. So it's basically the fear of the unknown at this time, as well as the spread. The amount of spread which we are seeing, it has really caught people off guard.
I see. So how about the incubation period? Because we've heard this on the media. They're saying, okay, there's an incubation period of 5 to 7 days, 5 to 10 days. What does that mean? What does incubation period mean?
Incubation is basically like, it's very similar to any URI. URI is basically upper respiratory infection when people feel like myalgias, muscle pain, bone pain, just not feeling well. I mean, the classic description is being hit with a truck. So basically they don't feel well.
I see.
So for a person from getting the virus in the body, and by the time they feel like that, that's basically an incubation period before they start being symptomatic. So yes, it's a classic, and it's not just with corona, but it's very similar to the rest of the URI viruses. It fits pattern between 5 to 14 days. I mean, but still it's a moving, I mean, the duration is still not set though. We are still seeing people after 3 weeks though. So
okay, I see. So we don't know exactly what's the life cycle then. We're not certain about that, but we know that there is a certain incubation period.
it's very similar.
Okay.
It's very similar to the viruses which we already know about.
I see. Okay, good. Samir, do you want to jump in on this?
Well, I'll just add a couple of things. Obviously, he's the infectious disease expert, and you know, you're asking the difference for the layman people. I think it's important to know why, like, because there's a lot of stuff being propagated in the media that, you know, flu kills a lot more people, and we have flu every year. So that's the main thing I think from layman's standpoint. What to know the difference. The difference here, okay, from the pulmonary critical care standpoint, is just looking at it from from outside here, is that you know, when you talk about I'm talking about the United States. Now, obviously the world, that's a little bit on a larger scale, but taking a look at the United States, our population is around what, 350 million people. So if you take that population and you say to the as a flu, it has a mortality rate of 0.1%. Okay. So in terms of, and that's still a lot if you take the entire US population. But when you talk about this virus so far, as Dr. Sharief said, we don't know everything about it. We're learning on the fly because this is a novel virus. It was never in the human population. We're seeing it now. So we have to take what we have in front of us, which are the cases that occurred earlier on when this pandemic started, which is China, and now we have Italy and we have Spain. So we're taking a look at all of those things, and the numbers are varying, but they're definitely like around 10-fold higher. Okay, so we're talking about anywhere from 2 to 3% right now, or some cases even have up to 5% mortality, which means that if you take the entire, like these infectious disease experts, and they say that around 40% of the US population, 40 to 50% will contract this virus at some point or the other, and you take the mortality rate take the lower end, take 2% of that, you're still talking about hundreds of thousands of people. So that's just the mortality part. And I mean, I don't want to we'll talk more about what that means in the healthcare system and why
so
more people
just so that our audience is clear, mortality means the death rate, correct?
Mortality means the amount of people that will die as a direct result of the virus. Now, there's other people that might die from other reasons because they can't get into the hospitals for their normal, medical problems that we see on a daily basis. But as directly related to the virus, okay, which we'll talk about some of the ways that can kill you, that's what we're talking about. So that's the way it's different compared to the flu. The other main...
Yeah, let me hold out to you. I'll hold you for a second here. Let me get back to Dr. Sharief, and I just want to clarify one more question here.
Sure.
Now, you mentioned that we get these little localized new infections, new diseases that can come and they're contained. A few years ago, we had SARS, right? We had SARS that obviously it started in China as well. And it was the same sort of scenario where they spoke about it came from the wet markets. So just for our audience, the wet markets are where live animals and livestock is sold. And this is where most of your interaction between human and animal happens. And so the history behind the coronavirus is that it was in Wuhan, and it was traced back to a particular market where livestock was being traded. So how do you explain, Dr. Sharief, now this SARS and now we have COVID? What's happening?
Yes, that's a good point. The thing is, there's always some local, but at this time it has been very different because the transmission rate is higher compared to the viruses which you already know about. And in fact, there are like two ways of transmission of the URI viruses. What you usually call it as a droplet. Droplet basically is maximum 6 feet. It needs someone to cough or sneeze, that part. But in this, the difference is also we are seeing an airborne. Airborne basically means if a person was in the room, he has coughed or sneezed, even if he has left the room, there is still the virus particles in the air. So even with not a direct contact, people are still catching the infection without a direct contact with the person. So the droplet as well as airborne transmission has made this a much bigger problem.
I see.
I mean, people are contacting it much easily, unfortunately.
I see. So there was a question in our chat by Mozam. He asked, how does one get infected? So Dr. Sharief just answered. So it's a droplet as well as airborne, right?
I would have to interject. I think the CDC has not confirmed yet whether or not it's an airborne.
I see. Okay.
We still don't know 100%. Mm-hmm. There are some procedures while patients are in the hospital that cause it to what we call aerosolize.
Yeah.
So far, the CDC has specifically stated that it's now, Dr. Sharief, you can correct me. From what I've been informed, and I looked this up just to make sure again, it's the CDC, and we can talk about whether or not to trust the CDC. That's one thing. But I'm talking about in terms of what we know so far from evidence is that it is primarily droplet transmitted, and these are large droplets. The other issue with this, the reason why it's so different and the reason why it's causing a bigger problem right now is because most of these other viruses that we talked about, you talked about SARS in 2003, and then you talked about MERS that occurred, I think it was 2014.
Yeah.
The difference is that when you got those viruses that people exhibited, like we talked about the incubation period, people exhibited symptoms almost immediately, okay? And they got sick very immediately. So you know at that point you're sick and you stay away from people and you get quarantined. The issue here is that people are walking around with this virus for, as Dr. Sharief said, up to 14 days sometimes, and even longer, with no symptoms. So it's like hidden, and that's why it's being transmitted so easily, because people are walking around with it, not knowing that they're infecting other people.
I see. Okay.
So that's the biggest issue that's causing the spread, is that people are spreading it unknowingly without having any symptoms, and that's the difference.
Exactly. So many things are still unknown about it. And yes, the droplet, like any other URI, has been proven, but the way it's getting spread, I mean, it's still, the science is up in the air. But transmission is a bit more, and exactly as Samir said, like people are showing the symptoms later, so it's hard to say. But at the same time, we need to be a bit more different, like in terms of, we can't be paranoid and fearful about it, but as someone said, like sneezes in the backyard. I mean, once, it's not like everyone is gonna get it. Like if someone sneezes in the backyard, I mean, like it's not that like everyone is gonna get it, but at the same time, it's definitely important that the good hygiene measures and whatever has been recommended so far, definitely they need to be followed.
Okay. Let me get in Abdur-Rahman. Jawad, please see if you can unmute Abdur-Rahman, please.
Oh, yeah, I was hearing some background from him, so that's why. And anytime he needs to unmute, he can just press *6.
*6, okay.
Yeah.
All right. Assalamu alaikum, Abdur-Rahman. You with us?
Assalamu alaikum.
Hey, we were getting a lot of background noise from your hospital.
Sorry.
The one single window that you have in your.
You can mute me anytime. I don't know how. I'm on my phone, so I don't know how I can unmute myself. But
all right. So I know you just got out of your shift, so you're in ICU currently, and you guys from internal medicine, unfortunately, you get treated pretty badly, because you end up seeing basically seeing all the patients, people with COVID, people with not with COVID, dealing with people with diarrhea, heart attack, stuff like that. You're the workhorse, essentially, when anybody comes through the ER or gets admitted directly. Obviously, your work is pretty stressful, just because of the amount of patients that you have to deal with. And secondly, being a resident, you're just down the the totem pole, right? So
pretty
at
much,
your hospital, I mean, you guys don't have to reveal which hospitals that you guys work with, but so Abdur-Rahman, Dr. Abdur-Rahman, he is at an inner city hospital. So he sees quite a bit of things there, from trauma to gunshot wounds to infections and whatever stuff that you see typically in an inner city hospital. So tell me, what's going on at your hospital? How are you guys dealing with this?
So there's a lot of things. There's a lot of moving parts, and there's a lot of things that are going on, especially with people who are in residency, trying to coordinate with other residency programs that we have at the hospital, and trying to find the right amount of people to cover each shift, each rotation, you say, and then the hospital itself. So we've been pretty proactive. I think our programs have done a good job about making sure the residents have enough resources, enough time, and enough coverage to kind of tackle this. I believe it was, I think, 2 weeks ago where we started seeing, Corona and COVID, maybe 2.5 weeks ago, we started seeing an influx of it. And for the past maybe 7 days, we've been seeing a lot more.
So when you say a lot more, do you
maybe
have some numbers for your specific for your hospital?
So we, I don't have numbers in front of me, but I can tell you, I can tell you what the changes we've gone through is. We converted one of our ICU units to just be a COVID unit, which is full at the moment, and then we have another floor which is ICU unit, which is on a different level, a different floor that's covered with non-COVID patients.
Okay.
So that's a big change because we just split up a whole unit. And then we have a floor that is now only patients that are suspected or are waiting for their results to come back that are being admitted there. And that's a floor that has 40 rooms maybe. So we have 40 single rooms. So we have about 40 some patients in there. And then ICU, one level is full, the other one is non-COVID patients. Okay. And then from the ED standpoint, pretty much, everyone we see is a rule out almost in the past, at least for the past 3 days. I think people are deciding to not to come to the hospital, but the ones who are coming are the ones who actually have symptoms, and they're likely, or they fall into that screening criteria where we have to screen them for coronavirus. So that's the stressful part, where the influx of people that are coming in are all coronavirus rule outs. So where do you put them? How do you keep everybody safe? And that's kind of the challenge I think every hospital is going through.
Right. So just managing that influx and making sure that the infected and the non-infected are separate, but you obviously don't know right away because the testing takes some time, right?
Yeah, the testing takes time. Right. The test itself, I think Dr. Sharief would probably be the best person to, and Dr. Zaheerullah here would probably be the best person to kind of comment on the testing sensitivity and the time it takes. What we're seeing is that we actually send it to IDPH, which is the Illinois Health Department. Right. We don't have an in-house test because we are a small community hospital. Not small, but we're a community hospital in the inner city of Chicago. Yeah. So we don't have that luxury. So we do have to house the people that are rule outs for 3 to 5 days almost. So
until you get the test back, basically.
Until you get the test back.
Right.
Yeah.
Okay. So, Dr. Sharief, if you could jump in, tell us what this testing is. I mean, there's a lot of talk in the media. The President Trump has spoken about this at all, getting these tests done. He at one point said, anybody who wants a test gets a test, right? And obviously this was not the case. What is this test, and how long does it actually take?
So that's a big topic by itself. The test basically is first who needs to be tested, and the second thing when they really get tested. Test results we have very similar in Indianapolis. It goes to the Indiana State Department, and once the state is testing, we are getting the result within 1 to 2 days.
Oh, okay. So 1 to 2 days from your side. Okay.
And they were very strict about who needs to be tested as of the week before last. But last week they have been a bit easy, so they have an easy criteria now to get tested. Second thing, the commercial labs over here are also offering, but their turnaround time is approximately 3 to 5 days.
I see. Okay, that's true, because in our group we have a large group with a huge amount of patients, because it's a private group, not hospital connected and so forth. We still don't have a lot of these tests back, and it's already been like 5 days, and we go through a private LabCorp testing facility. Dr. Samir, what's the case in your situation, in your, because by the time you see them, they're already in ICU, so they're already tested.
I think this is probably one of the key areas that we essentially failed as a nation. and the leaders of this nation is the testing. The testing, the issue is this. One, I mean, by the way, like what we're saying to you right now, right? Like what is this? Today's Sunday, like at 1 o'clock, right? PM?
Yeah.
What we're saying right now can change like tonight. Okay. So some of the stuff is changing as we're, especially in the past like couple of weeks, things have been changing. Who can get tested? You know, what are the criteria? So that's why we're like being inundated, especially if you work in multiple hospitals with different criteria. For us, for Illinois Department of Public Health, when we send out the test, it was taking, most patients were taking 7 days. That's a lifetime. And so the issue with that is that now once you're waiting 7 days, the patient's in the ICU and you're wondering whether or not you can move this person and stop using, you know, everyone knows what PPE is now, stop using the PPE on these patients that we're like literally wasting by the time that test comes back and shows as negative. So, and it takes a lot of resources to have somebody, you know, isolated and things like that. Their care may not be as appropriate because not many people are going into the rooms, which is appropriate. We should not everyone needs to go into the room. But what I'm saying is that there's a lot of compromise that occurs when the testing results are taking that long. And the reason being is because obviously there's a lot of tests all at once that were occurring. And so the Department of Health that was doing this testing, you know, they have to bunch all of these tests together. There's a reagent that's there that gets that's required, and they don't want to waste it. So they take a bunch of cases, like 100, 200, whatever their number is, and they wait. So even if you had a test, they're not going to send out the test until they fill up their criteria. So this was a delay, but those things are changing. It's likely, you know, we need to do it, obviously, but the delay is what caused the problem. There's more private corporations getting involved. There's a turnaround test that's coming out within like 5 hours now, or less than that. Some say 15 minutes. So all these tests are coming in, but for them to start, you know, getting these tests out is going to still be a while.
Now, let me get back to Dr. Sharief here for a second about these tests. How sensitive are they? I mean, because, you know, because the problem there's the thing, oh, it's still being made in China, right? It not, like something of that sort.
Like any other test, it's not 100% sensitive, it's not 100% specific. Yes, having it helps. It's like a piece of the puzzle. A test result definitely helps, but even when the test result is negative, but if it looks like that, if it behaves like that, we are still treating it as a positive.
As a positive, okay.
Retesting them to make sure, because like as some of you must be seeing, I mean, like some of the X-ray pictures are very classic.
Right, the ground glass X-ray and all that stuff. Okay, let me bring in a question here. This is a question from Brother Tahir. He says the test of COVID-19 was not available commonly, and most of the infected people will not need hospital care. And without a test, we'll never know of the infection. Does the mortality rate still accrue, or is it still accurate?
Well, it's only when the storm settles we can really go back and say how much of the exact mortality rate. As of now, it's a very fluid number. That number but as per who needs to be tested, yes, if someone is not feeling well, if someone feeling short of breath or any symptoms, they should basically get themselves tested. But just out of curiosity, I don't think they should be tested. If someone was—
because it will overwhelm our healthcare system, basically. You just can't walk in and it's like, hey, I had a cough, let me go get tested. No, you're supposed to have more than that, right? Okay. Cough, fever, sneezing, stuff like that. Okay.
Sorry? Yes, basically do some good precautions, stay away from your family and friends.
There's another question from Brother Muslim. He says, I read about the Abbott 5-minute test that the FDA just approved and will be available soon. Is this test accurate compared to using PCR method? That's a bit, well, I think Brother Muslim knows a little bit more about PCR testing and stuff. We will let the question be. It's okay. It's not for general consumption, but like the brother Dr. Sharief just said, you know, not every test is 100% sensitive or specific, but we do look for clinical symptoms.
The number is being reported around 70% sensitivity.
Yeah.
What happens is if the viral load is not high enough, especially early on in the disease, then you may miss it. Okay. And then the other thing is if it's not collected properly, the proper way to collect it is you have a nasal swab that gets injected pretty far up there in the nasopharynx. so much so that it's actually uncomfortable getting the test. It causes a vigorous cough.
Sure.
So if it's not collected properly, then that could be false negative as well. So as Dr. Sharief said, if I see a patient and they have the classic findings, okay, then I would just, even if the test is negative, we're still keeping them in isolation and still treating them as a possible COVID patient. But the numbers around that we know for are 70 to 80% sensitive. Specificity is pretty high. Okay, so if it turns out positive, you know, barring some sort of contamination or something like that, then we can safely say that this patient does have COVID.
Okay. Let me table some questions for a second. There's a lot of questions coming in. Before we go to that, I wanted to get Abdur-Rahman online again. Just wanted to, because I know Samir spoke about PPE just now. PPE is personal protective equipment. Abdur-Rahman, tell me, what are you guys dealing with? Do you guys have, because you know there has been also in the news that there's not enough equipment, there's not enough PPE, the personal protective equipment available, not enough masks because people are hoarding, and so on and so forth. And there's, you know, there's shipments coming in. There was a news this morning that Germany had to trash about 600,000 face masks because they were defective and they were not protecting against COVID. What's the situation in the hospitals for us?
So PPE is a big topic right now. I think we're trying. I think our hospital specifically, I can't speak about other hospitals in Chicago, but we were a little bit more proactive as far as kind of limiting the use when needed.
I see.
Especially so PPE is basically your gloves, right? Your gown. You have a face mask or an N95, which the news has been talking about. N95 is a mask that can help prevent the kind of aerosolized infections. And then you have a face shield. So those are the key products that are in shortage all around. The criteria that we are using right now as far as who should wear it and who needs it and what kind of patient we should be using it on is basically any patient we feel like that may be positive for coronavirus or who's been admitted for a rule out. They end up needing to be, before we see the patient, we need to gown up and wear the PPE. We do have a shortage as far as surgical masks and N95s. Which is like the specialty kind of mask. The N95s are kind of reserved now only for high aerosolized procedures, like intubations or bronchs or you know, procedures that you're gonna cause a patient to cough up or you know, if they're going on a respirator or a ventilator, then those are the things that you need to. That's when you essentially have to use it. The other things, if you're just going to go get blood draws or just talk to them, not necessarily have to wear it, but that is part of the PPE that we use. So that's the main thing that's in shortage right now. And I feel like we're trying to implement some ways to recycle these masks, trying to implement ways where we can limit it so that people don't hoard these things. The things that we're doing here is that we assign, you know, a residence, but we get assigned at the beginning of your shift, like, here, this is your N95, you're going to use this for the whole day. And then you kind of like, there's a way to kind of reuse it, keep it safe and not cause infection going from one patient to the other.
Now, should people be buying these face masks and gloves and all of that stuff? I mean, for example, now we have the stay-at-home order. Obviously, this morning I went out to get something from the grocery store, and we have people with face masks and they're wearing gloves and so forth to protect themselves. Is that okay, or is it just you know, is not something that will cause any sort of an effect to the spread?
I think hoarding is definitely is going to hurt the healthcare system, especially in the case of N95, especially in the case of like surgical masks, which are actually, and gloves which are actually really needed for patients who are actually infected. The only time I think, and then Samir, you can jump in on this. The only time I feel like somebody should wear a mask is that if you know that you have been exposed, and you don't want to expose the people that you live with. In that case, and if you were positive and you're kind of mildly sick and you don't need hospitalization, yes, wear the mask until you fully recover. I think that is reasonable. But then hoarding it, wearing it to go to the grocery stores, wearing it while you're driving, that's actually, because you're going to drive with your gloves on and then you're going to touch your face. You're going to drive and then you can touch your face. So you're actually not really doing anything to protect yourself, really.
So in terms of protection, we go back to what the state has already mentioned: wash your hands, clean yourself, right? All of this stuff that's already been mentioned multiple times. We still recommend that.
I think we could reiterate, talk
ahead.
about it a little bit more over here. I think the main thing is washing your hands for that 20-second period. Just soap and water, wash your hands, limit the amount of times you touch your face, and then social distancing, which actually does help. We actually saw an influx of people coming into the hospital after that one sunny day we had on Wednesday.
Yeah.
Where before before the actual order went out, there was 600 some people on the lakefront. And Friday night when I was on call, that was miserable because we actually saw a lot of people come in, not because they started to feel some sort of fever, shortness of breath, and they basically ended up being admitted. So we had a lot of admissions in the past 48 hours.
I see.
Okay.
Let me take a few questions just so that we can get through them and then move on to some other topics. Dr. Sharief, your video is not working. If you could just go back on, that would be great for some reason. Let me see where we left off. So there's Brother Tahir asking also, is there a test to confirm if a person was infected and does not have active infection and was recovered? Samir, do you want to tackle that? I think the test is just a test to test if they're positive.
So most patients, as we said, even if they get it, they are going to recover from it. Okay. The only way we know that you had it is, to confirm it is through a test.
Okay.
And the only way to say that you don't have it anymore is usually we wait for the incubation period to be completed, which is around 14 days, which is, it could extend to 21 days. But the way that we're trying to figure out if somebody can safely be taken out of isolation is we'll get two negative, I just saw Abdur-Rahman with that.
Sorry. Oh yeah, I had to clean it off.
So
let me
we take two negative tests, okay? And then once they're negative 2 times and they're 14 days have passed, then we say they have essentially recovered from the virus and have built up antibodies to it.
All right. Let's keep the answers short. I'm going to kind of go through because there's quite a few questions here. There's a question from AM. What steps can doctors take to stay healthy during the COVID-19 pandemic? Abdur-Rahman, just quickly, few words. How do you stay healthy? You're probably the worst.
I'm probably the most exposed person here because just good to see a lot of people.
How many times are you showering? Tell us that.
after my shift and before my shift.
Okay.
And then, so the main things is that take a pair of clothes. Don't take the clothes that you wear in the hospital home. That's one thing I do. If the people that have been exposed, we're monitoring our temperatures twice a day. If you know you've been exposed to a known person that's positive, you monitor for those symptoms for 2 weeks, and then you kind of wear a mask around close people you're living with. And I've actually just been avoiding going home just because we have parents that have heart disease or have COPD or asthma. Those are kind of the most affected or most risk.
And I think we know of family members who are at the front lines that haven't seen their families for several weeks. including parents and so on. We'll get to that in a bit. Let me get through some other questions here. Of the reported cases, how many more estimated to be infected in the population and not yet accounted for? Dr. Sharief, do you have a prediction for us in terms of the numbers we may see as this, when we talk about this curve, we need to bring this curve down?
There will be a significant percentage who were exposed, but alhamdulillah, on the positive side, majority are inshallah expected to do better. So yes, there will be multiple times who must have got exposed compared to what we are actually seeing at this time.
Okay, let's go to another question. What are the ways you can get infected sorry, this is from Hamza. What are the ways you can get infected if you come in contact or in close proximity with COVID-19 infected person? We kind of discussed this in brief. It's droplet precautions due to droplet contact, essentially. And aerosolizing, there is still, FDA hasn't confirmed it, but we are still taking precautions in that sense. We covered that a few minutes ago. There's a question from F. Syed. Can there be people walking around who have recovered from COVID-19? If so, can they still be infectious? Does that mean they're immune? That's a good question. Dr. Sharief.
Yes, there are definitely people who got treated for it, but as of now, we are not checking. I mean, like any other URI, we don't check immunity. So, but it's most likely, inshallah, they should not get reinfected, but at the same time, the science about it is still evolving.
We don't know. Okay.
Yeah, we won't know for it at least for the next several months.
Okay, good. There's a person here, just for our audience, Dr. Sharief is having some technical issues with his video, but let's keep moving. iPad 3 to, this person is asking, appreciate if you can questions only in the last part. We want to hear more from the experts about their daily experiences. All right, very good. We'll get to that in a second. All right, I will take the cue to move forward. All right, before, there's another question. We spoke about PPEs. Now, let's speak about this ventilators. There's, Andrew Cuomo from New York, the governor, he said he needs 30,000 ventilators. And these are needed right now, and there has been an uptick in terms of what's the discussion on this, of what are ventilators. Trump comes along and he says, no, I don't think we need 30,000. I don't think that's the right numbers. Cuomo said CDC gave him 400. It's not going to be enough, because right now New York is the epicenter. New York or the tri-state area, including New Jersey and Philly and all that stuff. So Connecticut is the epicenter. We're seeing a lot of cases coming out of there. So there's definitely a lot of stress on the healthcare system. The question of ventilators, what are they? Briefly, Dr. Samir, you don't have to go into the whole details of what PEEP is, okay? Nobody understands that garbage anyway, except for you guys. But anyhow, tell us, what is a ventilator and is there a shortage?
Okay, so again, I'm a pulmonary critical care physician, so this is my field.
Expertise, yes.
So in general, a ventilator is basically a device, a machine that supports the vital functions of what the lungs do, which is they get you oxygen in your blood, and then they get rid of carbon dioxide. So there's two main functions of the lungs, essentially. And there's a lot of things that the lungs have to work with in your body, including your brain, which is the respiratory center, and then also the muscles that support this function to allow air to exchange like that. So essentially, when you get very, very sick, okay, and the lungs are compromised and other organs are compromised after that, the lungs have to work extra hard to get this oxygen in, okay, so that your body and your vital organs can continue functioning. And so what happens is when you get very sick, that the lungs have to work extra hard, and then eventually the muscles, they tire out. The brain gets affected as well and doesn't do that great of a job in telling the lungs to breathe harder. And then eventually the lungs can't just do it by themselves. So a ventilator is a device that supports you, okay?
Let me share the screen here, just 1 second, Sam. I want to show our audience what a ventilator kind of looks like. Oh, where did this go? Oh, sorry. So I don't know if you guys can see on the screen right here. This is a type of ventilator. Am I right, Dr.?
Yeah, so
yeah,
essentially,
okay.
I hope you guys never have to see this thing, but you know, when you see patients that you think about in the critical care unit, tubing down their throat into their windpipe, essentially. And so what this thing does is basically it's able to support higher levels of oxygen than we normally use, and it's able to basically essentially rest the muscles so that your body can recover, and then eventually we try to take the ventilator off. So there's a couple, that's just essentially what it is. It's a very vital, and we use it not only just in the COVID crisis, we use this in any patient who's very sick and overwhelmed, okay? Whether it's a pneumonia, heart attack, sepsis, what we call, okay, ARDS, all of these things are, these are disease elements that occur in the critical care, and we take care of it all the time, and the ventilator is essential. Okay, that's number one. Number two is the issue, the difference between this current illness and other illnesses is that, say, you guys will hear this term ARDS, which is a disease entity that's caused by any kind of severe illness, okay, acute respiratory distress syndrome. The other causes of ARDS, usually in my experience and from the data, we are able to extubate patients, meaning that liberate them from the ventilator, you know, in like 5 to 6 days on average, okay, when their disease is well controlled and their lungs are doing more of the job. Then we try to take out the ventilator as soon as possible because there's risk and there's complications that can occur from the ventilator itself. But the problem with this, what I'm seeing in my critical care unit, which essentially is full of all COVID patients now, and we've had to expand, the problem is that these patients are staying on the ventilator longer. They're needing it longer. So not only, and we're averaging anywhere between 10 to 12 days if we are able to take the patient off the ventilator. And so far, this is all early. A lot of people are unable to get off of it and eventually die. But in terms of the requirement is allocating this ventilator to that one patient for a longer time that comes into the ICU. So not only is there a shortage, but then we're also dealing with needing the ventilator for a long time, which is contributing to the shortage. So the numbers are this. For the US, there's 160,000 ventilators in the United States. Okay, that's if you take all the states. Okay, obviously the inner city populations and those heavy populated areas, they have more ventilators, obviously, than the rural areas. And there's another around 10,000 in stockpile. So the projected numbers is that the worst case scenario, you're gonna need over 1 million ventilators. And most scenarios are saying around like 500 to 800,000 ventilators. So there is a significant shortage. So if you talk about 160 and you need around 500,000 at the like moderate case scenario, there's a significant shortage. Now the Trump issue is this. The Trump issue is saying that he's looking at the numbers right now and saying that, hey, New York, you have 30,000 already in stockpile. Why do you get the number? But why do you need it? The issue is that we're trying to project the you know, like how bad it's going to get and how much we're going to need. We've already messed up by underestimating how severe this thing was going to be. And now we need to plan ahead. That's the Trump issue. And it's gotten, I mean, hospitals, like even my hospital and hospitals across the country are preparing that in the event that we need to get to this case, which is that there's not enough ventilators. And we've already dealt with this in my institution, that we're already having to take ventilators out of stockpile, is that we're now even considering in a worst case scenario, how to split these ventilators, which is use one ventilator to ventilate up to 4 patients or sometimes even 7. And honestly, this has never been tested in human beings per se with any trial. This is all kind of anecdotal data, and we use fake lungs, okay, artificial lungs, to see, you know, if we can do it. And technically you can do it, but all of these things are like just theoretical, and it's kind of worst case scenario. And the fact that we even have to think about this is pretty, I'll be honest with you, it's pretty scary, from at least from where I'm dealing with patients and when they get really sick and come to the critical care unit.
Okay, very good. Let me move on to a different topic here. I think this will kind of hit a lot of people at home, this issue of quarantine, right? Because now we've been told across many countries around the world, in European countries, in Middle Eastern countries, basically it's been across the globe, basically we're saying stay at home orders, right? That we need to keep the healthy people at home. and only treat the sick, and only go out as needed for whatever groceries you need to go to work, etc. And it has caused quite a bit of stress on parents because of the kids staying at home and so forth. That's a little different. I'll come to that as well at the end. But what is, there's this concept of how to quarantine. Do you do it what we call as a herd immunity versus what we are saying isolation, stay at home, and keep the sick at home? How do we look at this, Dr. Sharief? Just so that Dr. Sharief, you're on mute. Jawad, can you unmute him, please? Okay, go ahead.
Okay. Can you hear me?
Yeah.
Yeah. So the social distancing and the quarantine is definitely with the goal of, inshallah, preventing the spread further. And it's the herd immunity is going to factor in later. It's too early to say anything about the herd immunity.
Okay.
But
can you explain what herd immunity is, please? What is herd immunity?
Herd immunity is basically if there is a significant percentage of the people who already have antibodies against a particular illness, then the transmission gets dinged. So the rest of the people who are at risk to catch it will not statistically have a lesser chance of catching it. That's the same philosophy which is used in polio, in measles. So even though the goal of those vaccination would be 100%, but it's not practical. So as long as 90% of the people have got a vaccine, inshallah, that takes care of the rest of the 10% of the people too.
I see. Okay.
But coming to the corona, I mean, the herd immunity, this is the first time we are seeing it. So we are not expecting any herd immunity for it at this time. I mean, basically, it's going to take time for the body to respond and make antibodies and prevent a future infection and all those things. But as of now, with the quarantine and those things is basically with the goal of preventing the spread.
Okay. So you think the measures that are being taken now, we'll forget about what was done in the past, but the measures that are being taken now to keep people at home, limit amount of contact, stay-at-home orders, quarantine them, keep the elderly, especially people who are 65 and above with comorbid diseases, comorbidities and so forth, especially them to be careful not to have unnecessary exposure. Do you think on a societal level, because it's been done throughout the whole, basically in certain states, of course, here within the United States, we've got several states that are doing it, but in other countries are in complete lockdown, for example, Italy. Have we really come to that? And is this something that we are now forced to do?
Well, that's a topic in itself. The thing, talking about United States in general, yes, to some extent, the goal is still to prevent the spread, but at the same time, some of the steps which have been taken by some companies and some corporations has been because of the liability issue. So the liability issue as well as the transmission both have played a role. But other countries, I can't speak on their behalf, but what we are doing in states is basically, yes, definitely a public health measure, but at the same time, some of the policies are also because of the liability issue.
I see. Abdur-Rahman, do you think this issue is accepted throughout your healthcare system? Or are there people who are saying, you know what, let's not do this. Let's just keep people who are sick in the hospitals. Everybody else can just be fine. We don't need a complete lockdown. What do you think about this?
You mean as far as our hospital, or you mean as far as the state?
Both, because it affects the hospital too, right? I mean,
yeah,
I think state policy affects your hospital.
I think looking back now, I think that it was probably needed maybe a week and a half or 2 weeks before we actually did it. So because how the virus works, and just because how long this incubation period could be 5 days versus 14 days, and going on long as 21 days. The fact that we didn't do it a little bit earlier, we're seeing a surge of more patients now that are getting sick. So that social distancing that wasn't being done is affecting us now.
Okay.
So I think it is very necessary at this point, just because it's not going to overwhelm the healthcare system. Because we'll still see patients at, cycles instead of peaks.
Yeah.
If you hit a peak, what New York is feeling is they hit a really high peak.
Do you really think that's a peak, or do you think they're still going to climb?
I think it's still going to climb. I think the United States, we are all still going to climb. If you look at countries like Italy and South Korea, maybe not Italy, but South Korea and also China, what they did was they went on a full lockdown. They went prophylactically on a full lockdown and maximized their testing. So the end number, the amount of people South Korea tested is so huge that they actually stopped the transmission or slowed down the transmission very quickly, very dramatically. And they took those steps very, in a way that maybe we should learn from going forward. But right now, what we're doing, I think, is definitely necessary. I think most states that are seeing an influx should go on a lockdown, in my opinion. Yeah.
Okay. All right. There's 3 more topics that I want to speak about. So we'll talk about the healthcare system, because that's been mentioned quite a bit. And then we'll talk about certain advice that you guys have, and then we'll speak about it on the Islamic perspective, and we'll close with that, inshallah. But before we get into those 3, I know we're going a bit an hour now almost, but I want to kind of hit on this issue of your personal experience. Yes, we spoke a lot about the clinical stuff now. What I want to know, or I would like our audience to know, is that what are you guys feeling? How are you guys dealing with this? How are you guys managing home life, your mental state, and the stuff that you have to go through? Because it's a very, very busy time, and the precautions that you guys have to take. In some cases, certain physicians have not seen their families, they're quarantining themselves. There's a lot of things that are happening at home for you guys, and a lot of things that are happening at the hospital for you guys to deal with. Just share something with us. I'll start with Samir. Why don't you go with that first?
Okay. I think I just wanted to get one point before I speak about that, which I think is important, I think, for everyone to hear. And Dr. Abdur-Rahman talked about it a little bit, but if you guys are feeling like, why do we need to stay at home? How long is this going to last? Let me just say like one statement for this. The issue is the influx of patients that are coming to the hospital all at once. That's the biggest thing. And the hospitals, they're not equipped to deal with that. And so what happens is, God forbid, you need to go to the hospital for any reason other than COVID, whether it's like you have a pneumonia, or you had a heart attack, or your loved one. I mean, we all know people that have medical illnesses. Some are young, like have asthma. And I see asthma patients coming through the ER all the time, and I have to admit them sometimes. If all of this stuff peaks at once and the whole hospital is taken over by COVID patients, the care of even the routine stuff that we deal with, that we could treat easily, it's getting affected, and we just don't want that. So that's why, and I want the younger people that are watching this, please understand, I have 2 patients that are under the age of 30 in my ICU. I have over 21 patients that are intubated, and 2 of them are under the age of 30. Half of them are under the age of 50. So if you're thinking that this can't affect the younger people, I can't explain to you why, because that has changed a lot in terms of, that was affecting the majority are still older people that have health problems, and especially the ones that die, they are older. I get it. They are older and they have chronic, but we are seeing younger patients. And so that's kind of the fear and anxiety. Things are changing a little bit. Maybe the older people we're not seeing as much because they're taking these quarantine things more seriously than the younger people, and the younger people are getting out, and now we're seeing them 2 weeks later, after they got the virus. So let me start out with that. That's why it's important for us to all follow this.
Just to add, we're seeing the same thing here. We have pretty much, I would say, less than 50, and then an influx of just 20s and 30s patients. Yeah, which is a scary part.
They might have some underlying problem that didn't manifest. Maybe they had some illness or something that they never knew they had, and this virus is now manifesting that. Some of them are completely healthy. They never smoked. So I'm just saying that it's still the It's still not as much as the older, but it's still there. So just know that.
Samir, just so that, sorry to cut you off, but I wanted to bring in this because we, obviously yesterday we heard that the first infant from COVID passed away in Illinois. Do you know something about this?
So I didn't hear that case, but just keep this in mind. Most children are going to be carriers of the virus. So they're going to be asymptomatic. They carry the virus. Even some pets are carrying the virus.
If they're exposed,
it doesn't necessarily mean that you can directly link the death to that virus, unless I don't know the case specifically. And from these are the things I don't want people to bring up unless it's a clear pattern, because then it's going to bring unnecessary fear and panic. So infants, children are really not affected. If you hear one case of here and there, and there's a pathophysiology thing that I don't want to discuss behind why children are affected, but in general, the one thing that I can tell you, the trend-wise, that younger patients, meaning under the age of 50, relatively, and some are under the age of 30, we are seeing them in the ICU. Okay, they do survive. Okay, but they do come sick into the hospital, and 2 of them right now in my hospital are intubated under the age of 30. So just giving you what I see and what I've been hearing from my colleagues all over the United States. Now, getting to my personal, so personally, the way it's affected me, obviously I had a beard the size of Dr. Sharief there.
Dr. Sharief.
I couldn't go full skin yet because that would have been too dramatic of a
do it
for me. But I'm thinking about now I have to do it because I'm seeing, I had this device, what we call a PAPR, which is like a full face helmet that you can have with a beard. But that's running out of stock and it's stretched. So now I will have to take the step and go ahead and probably shave off the beard, unfortunately. But that's a small sacrifice. The bigger thing is, in the hospital, especially in the critical care unit, now even Dr. Abdur-Rahman is working there. I mean, what we're seeing is unbelievable. I mean, there's patients in the ICU that family members can't come and sit next to, when they're sick. That's what's hitting me really hard. So, and unfortunately, the nurses are so busy now. The doctors are so busy because everything takes more time when you have to properly protect yourself before going in a room. So things that would have normally taken you half the time are almost doubling, okay? So unfortunately, we don't have time to contact families every day. We're trying our best. But when I do contact the families, like the end of my shift, I will spend another hour just trying to get to the family members. And they're very emotional, very distraught at the fact that they can't even come and see their family member, some very close to dying. So that's very hitting me hard. And then obviously coming home, honestly, nobody knows much as far as, about this children thing that's up in the air. As I said, I don't want people to become hysterical for no reason. But, you always have in the back of your mind, am I really, harming my family? Am I putting them in harm's way? What should I do? I take all the steps possible, but, there may come some point where a lot of doctors are basically quarantining themselves in a different place or sending their families to a different place. And the thing is, I would do that if I knew okay, this is a 2-week thing, but we don't know how long this thing is going to go. It may go for months. It may go, past months. So it's difficult to say, because if you had like a light at the end of the tunnel, okay, this is only a 2-month thing and I can do it. So it's hard. I mean, how it's going to affect the family and everything. We're just putting our faith in Allah that He'll take care of us. I'm taking my precautions. I'm just hoping that the numbers go our way in terms of young people not being affected and kids and things like that. I have 4 kids that don't want to stay away from me. They're kissing me here, licking me.
Licking
hard. It's hard,
Yeah.
And, I don't see my kids that much to begin with. And now that I have this time off, 3 days, I mean, they want to see me, so it's hard. The fear is there, but, we have to put our faith in Allah, and hopefully we're one of those common cases that just gets a mild symptom and then moves on.
Okay. Abdur-Rahman.
So kind of, along the same lines as Samir, the hardest part during work is the hours and the stress of a lot of the unknown, because you'll see a lot of patients that are doing okay, but then 8 hours later in your shift, they're not doing okay. So that's the scary part when you're on call. And then you're just seeing too many patients at once, at all the time, that are all sick, and you want to treat all of them, but you just have to maximize your time and prioritize who needs to be seen right away and things to do, and be safe for yourself also, and your team. especially the nursing staffs who actually have to go into the room a lot more than we do, just to deliver meds or just to change like the IVs and stuff. They need a break too. So we've been kind of like trying to rotate everybody in and out so that nobody gets exposed as much. But you know, that's part of the job here. As far as like family, me and another resident kind of have been switching shifts. So we are just sharing an apartment. Basically, the shift end I go, his shifts end he goes, but I leave. So we're not exposing each other. And then going home is the only thing that's kind of you know, hard. I'm trying to stay away from, you know, parents and stuff because they are, you know, older people who have comorbidities and like, you know, I've definitely been exposed. I was working with a resident who is COVID positive, right? So,
yeah,
you know, you have to be just kind of be cautious and monitor yourself. So that's the hard part.
Dr. Sharief.
Yeah, I mean, it's basically, I would mirror what Samir and Abdur-Rahman said. And I mean, it's at work as well as at home. At workplace, initially, when we started the trickle of the cases about 2 weeks ago,
yeah,
we were still seeing the patient. Like we were still seeing the patient because it was just starting. And then in the last week, we are kind of prioritizing which needs to be seen, which doesn't need to be seen. And a good majority of the patients, we are on the case without actually seeing them. And it's kind of, I wouldn't use the word frustrating, but it's difficult, like doing the patient care. And even when you go into the room, you want to protect yourself first. So you kind of minimize the amount of time. And then afterwards, when you're chatting with when you're discussing with the family over the phone, because none of their families, very limited of their families are in the hospital. Majority of them, you're discussing over the phone, like telling them in which cases you are using hydroxychloroquine, in which case you are not using the hydroxychloroquine. So I'm like, it's an explanation of all those things over the phone without much of a face-to-face interaction, which is a bit difficult.
right.
And the patients who are not doing well, and you kind of feel for the patient's family. They want to come to the hospital, but they cannot come to the hospital. And like, it's all those emotions you have to deal with the patients, as well as outside the hospital. Like, I know it differs from state to state, from county to county. I have a long commute to work. Like, it takes me about an hour. So at my home, the county, yes, there is a good amount of vehicular traffic and everything, which is restricted, which helps in overall, like the quarantine thing, in reducing the transmission, which is alhamdulillah good. But the place which I go to, you still see life goes on as usual. So when you see in the hospital all this disaster, and outside the hospital, when you still see people going about with life as usual, you really need, I'm like, I don't want to talk politics, but it really needs to come from the leadership, which trickles down, that the importance of the strict isolation and those things, which is important, no doubt about it. But it has to come from the leadership of the country as well as the leadership. So, of course, you can't discuss everything outside about the politics things, but seeing the result of this affecting the patient care, affecting the influx of the patients is really frustrating. And when you come home, obviously you don't want to get into a panic mode, but at the same time, yes, the science is there about just a droplet being the main mode of stay, but there is something called as a fomite, not to make people paranoid and those things, but at the same time, like your clothes which you wear, the stuff which you carry in your steps, there is statistically a small percentage that those may be a carrier. So you want to keep everything, you kind of become obsessive, compulsive, and paranoid, but at the same time, you don't want your family members to feel that, because, so I mean, it's a lot of balancing things. It's a lot of balancing things, taking care of yourself, taking care of the family, taking care of the patients, and it's being like a juggle. It's a juggle.
That's right. Let me bring in. I mean, I know I said we'll speak about the healthcare system, but I want to kind of table that, and just because of this issue of dealing with families and everything that's coming in that you guys spoke about, and trusting in Allah, I wanted to let me table the discussion on the healthcare system for a little bit and go into understanding this from an Islamic perspective, in terms of how we look at disease and calamities and so on and so forth. And I think we all will know this, and alhamdulillah, I think our understanding benefits us in dealing with issues like these as Muslims, because what Islam teaches us is that sickness, disease, death, the shifa, the cure that you have, the life that you have, this all comes from Allah subhanahu wa ta'ala. Ultimately, He is the one who is in control. Ultimately, He is the one who gives life, gives the risk, takes the life away, gives the sickness, and also gives the cure. So there is a mental, psychological perspective, because we're grounded in this idea. We're grounded in this aqidah of Islam. And that actually, I think, really helps us maintain a stable mind, because we know this is from Allah subhanahu wa ta'ala, and we are being asked and we're being tested to go through this test like any other test. What do you guys think? Does that help us as Muslims, especially you guys as physicians dealing with this? How have you relied back on Allah subhanahu wa ta'ala? Have you guys increased your ibadat? Have you guys spoken to your patients and to your families about the mortality that ultimately, look, a single virus can bring the world down, crash the stock markets, cause a lockdown on people, question your own mortality if you believe in something. Have you guys, Dr. Sharief, I'll start with you. Share us some thoughts on this.
It does. Alhamdulillah, it's a nice opportunity for dawah also. Like in the physician, we go to the physician lounge to unwind and those things and kind of vent our frustration with our fellow physicians. And definitely this, being such a minuscule particle, can bring the whole humanity basically to its knees. Certainly shows the power of Allah subhanahu wa ta'ala. Like people call it creator, some people call it something else, but definitely it has kind of helped start a discussion about if there is a bigger being, there is a bigger being in control and those things. Not everything's a fluke. So definitely it has kind of started the discussion between my colleagues and those things.
Good.
On a personal level, of course, it is difficult, but at the same time, as a Muslim, yeah, it's like any other disease. It helps kind of reset our thinking. And alhamdulillah, like, of course, we follow the precautions, we follow the public safety measures and everything. But at the same time, if something is meant to hit us from Allah subhanahu wa ta'ala, it's not going to miss us. And if something misses us, it wasn't supposed to hit us.
Right.
Yes.
Let me bring in an ayah just to, from Surah Allah subhanahu wa ta'ala, about Bismillah ar-Rahman ar-Rahim, He says in Surah Al-Taqabun, He says, مَا أَصَابَ مِن مُصِيبَةٍ إِلَّا بِإِذْنِ اللَّهِ وَمَنْ يُؤْمِنٍ بِاللَّهِ يَهْدِي قَلْبَهُ وَاللَّهَ بِكُلِّ شَيْءٍ عَلِيمٌ. Allah Azza wa Jalla in Surah Al-Taqabun, He says, no calamity, right? No calamity befalls you except by the permission of Allah subhanahu wa ta'ala. And whoever believes in Allah, He guides his heart. And Allah is all-knowing about everything. And it really hits, this ayah really hits to anything that we go through, whether it's an earthquake, whether it's disease like this, that ultimately we believe and focus on this point that this is from Allah subhanahu wa ta'ala. Samir, would you like to add something to this?
So in terms of what Dr. Sharief was saying, on a personal level, professional level, honestly, on the professional part, I'm just telling you frankly, it's hard to get any time to talk to anyone about anything except for patient care.
Yeah,
it's a different situation in the critical care unit. Obviously, just for me personally, dealing with families and everything, they see my name. They know my name is Mohammad, last name is Zaheerullah. So, I mean, even before this calamity, I always try to make it a point to talk to people with respect and dignity, so that I'm representing, my name, which is representing essentially my deen, my creator, to them. And that's just from a work standpoint. Obviously, it helps you stay grounded in the fact that, that some people were literally telling me that, hey, you just started like 6 months ago, 7 months ago, like these thoughts were coming, especially like my parents were kind of thinking that. They were kind of pointing that to me, hey, can't you just take some time off, things like that. And I was like, you know what, like, me being a Muslim, that should give me additional reason why I should go on the front lines and do this stuff, because this is what I was trained for. If you look at even the non-Muslims, we all take something called the Hippocratic Oath, okay? And when we become physicians or whatever, in any kind of healthcare field, right? We are there, and our first and foremost is do no harm and to try to treat patients, to the best of our ability. So at this time, if there's any fear or anything like that, of course, my faith in Allah subhanahu wa ta'ala keeps me grounded and makes me go back and try to help patients more, even though there's this fear in the back of my head that am I harming myself? But, as Dr. Sharief said, everything's written by Allah. I could sit at home, go to a grocery store and be infected there and not be infected at the hospital. So these are the things. In terms of, just from just looking at a general aspect, like, the ayah was that Dr. Abdur-Rafay just recited. I mean, for me, the thing is that made me realize is that, and I try to instill this in my kids and my family, is that and this is part of the issue that happened in the United States, that, hey, we're sitting here in the United States with all the security, all the nutrition, all the wealth, economic power, all of this stuff is always there. And that's why when SARS happened, it's kind of like the boy who cried wolf. Like, oh, it's not going to affect us. It's there in Southeast Asia,
it's out somewhere,
in this third world country somewhere. It's not going to affect us. And even up to the point where cases were happening here, like, oh, you know what, we have a control over this. And that stuff was there. But it just goes to show you that Allah subhanahu wa ta'ala at any moment can take that security that you thought you had away from you in such a way that no power, no economic wealth, no nothing, no medicine, nothing can help you. And that just brings you to appreciate and return back to Allah. So it's kind of like that Allah subhanahu wa ta'ala has shaken us, like people who are like in this comfort mode that, oh, I could do anything and nothing affects me. That, at any moment, Allah subhanahu wa ta'ala has the power to just change everything. And you need to return back to Him. So this is a blessing. I'm thinking of it as a blessing in disguise, that people who didn't have Allah in their life, now this is a wake-up call that, hey, come back to me. And that's the way I think of it. And that's the way I'm trying to teach my kids, because even the kids being here, they're like, why can't we go out? Why can't we do this? So I'm trying to tell them that, hey, that we have to be thankful to Allah for everything that we have. And that's my take on it.
Let me bring in another ayah, and I'll speak about this as well. Is that Allah subhanahu wa ta'ala in Surah Al-Ra'd, He says, about Bismillah ar-Rahman ar-Rahim, He says, الَّذِينَ آمَنُوا وَتَطْمَئِنَّ قُلُوبُهُم بِذِكْرِ اللَّهِ أَلَا بِذِكْرِ اللَّهِ تَطْمَئِنَّ الْقُلُوبُ, right? That those who believe in Allah subhanahu wa ta'ala and whose hearts find rest in His remembrance, right? And these are the people, He says, verily, and indeed, in the remembrance of Allah, do the hearts find peace, hearts find rest. So, at least, as for example, in my family, we, because now, alhamdulillah, we have a little bit more time. I'm spending a little bit more time with the kids and stuff. So we have, my wife and I have actually increased our activities, mostly online, attending more online sessions, reading more, trying to read the Quran more, teaching the children, because my kids are pretty young, but still learning the Arabic alphabets, etc. Whatever we're trying to do so that we can actually go back to this remembrance of Allah subhanahu wa ta'ala, and utilize the opportunity that He has given us to actually bring, go do more ibadat, right? Reflect more, read more, realize the ni'mas that we have, right? And also reflect upon the ni'mas or the stuff that people don't have, right? We alhamdulillah, we have a secure home, we have heating, we have running water, etc. But there are millions of people around the world who have suffered decades of constant bombings and wars and so forth. For them, that has been their life, right? So, and I find it very troubling when people say #bored, nothing, I have nothing to do, right? Or we're getting bored and sitting at home. I find that I don't find that amusing, to be honest. Everybody's on social media and Snapchat, Instagram, etc. And they're doing all of these things. I don't find that amusing because you're just wasting your time. This is a time that, especially for Muslims, for us to reflect on. Abdur-Rahman, you know, because you're, you know, a resident, you're constantly on the move. How are you able to keep up with your, let's say, your salah, your ibadat, your reflections, and so forth?
It's difficult. It's difficult. It's definitely something, you know, I've had a situation where I have to break my salah and just run away, you know, just from where, if something has been called overhead or whatever. And then sometimes you're busy, you miss it, and then you make up but you always constantly kind of thinking about your own mortality and what you have to do and what you want to do for the patient in front of you. I just keep remembering, like, if you save one person, you know, it's like saving all of humanity. That one of those hadiths that kind of just keeps me going, and that's kind of one thing that I went into medicine for. And hopefully also knowing that everything's from Allah, and the cure for this was going to be from Allah too. You know, it's just a time. You know, this is a test for us as a humanity, and I think a lot of people don't take what Samir's perspective is. I think the general people take the perspective of, oh, we're being punished by Allah. You know, we're being punished because now there's a pandemic. You know, there's like tsunamis and whatnot, and earthquakes, and now this is a pandemic. But you know, the perspective that Samir talked about is kind of the answer to that. And this is an opportunity. It's a test. It's a way to remember Allah and acknowledge His might, rather than the other way around.
And the other part, I think there's another ayah I want to bring in Surah Al-Tawbah. Allah subhanahu wa ta'ala says, He says, "La tahzan inna Allah ma'ana," right? Do not grieve, Allah is with us. You know, it's important because you know, there are certain Muslim families or even non-Muslim families that are affected. People are in the hospitals and so forth. Families are sad. The families of the healthcare workers are concerned. You know, they don't know what's going to happen. What if they get infected? What if they lose their life, etc. And so that's one part. And the other part is the other people who have lost their jobs, right? Because, you know, for example, my medical group is a pretty big medical group. So we have about 800 doctors in our system. There's maybe about 1,500 employees, and most of them are hourly workers. And we have had to scale down our operations just because we don't want to have unnecessary exposures to the employees or to the patients and the physicians. So this means I'm just giving my particular example, and I think it resonates with other people too, because let's say you're running a restaurant, you're running a grocery store, or you're running a small business, you're driving an Uber, for example. You know, your daily income gets affected, right? So this is where our aqidah comes in. It kicks in and says, look, this is from Allah subhanahu wa ta'ala. It will pass. This is a test. You will lose. Your risk is written. It was written way before you were born. Your life was written way before you were born. And this is where the perspective comes in of your aqidah, of believing in Allah, that look, this, you will get through this, right? The other thing is, what are you doing? Are you helping your family out? How are you helping your neighbors out, and so forth? And this ayah, La tahzan inna Allah ma'ana, do not grieve, Allah is with us. This was an ayah that was revealed to Rasul Sallallahu Alaihi Wasallam when Abu Bakr and Rasul Sallallahu Alaihi Wasallam were in the cave trying to save themselves from the Quraysh who were after them to assassinate Rasul Sallallahu Alaihi Wasallam. So this is where we're at, is that Allah subhanahu wa ta'ala is with us no matter what. Ultimately, whatever happens to us is from Allah subhanahu wa ta'ala. Whether you think it's good or you think it's bad, there is some wisdom in it, right? There is some wisdom in it, and our purpose is to remember Him. Our purpose is to go back to Him. Our purpose is not to be completely disheartened, or not to keep hope in Him, right? So la tahzan inna Allah ma'ana, and do not grieve, Allah is with us. Let me All right, let me actually bring in another hadith, and this is, I think, kind of gives a complete overview. Rasul Sallallahu Alaihi Wasallam, he says, each of you is a guardian, and each of you is questioned over his subjects. The imam, the khalifa, the leader, who is responsible over the people, and he is questioned over his responsibility. And the man is responsible over the people of his household, and he is questioned over them. And the woman is responsible over her husband's house and his children, and she is questioned over them. And the slave is a guardian over the wealth of his master, and he is questioned over it. Each of you is a guardian, and each of you is questioned over their responsibility. I think this is an amazing hadith because it talks about from a family, takes it from a family unit, from a husband and a wife, of how he or she takes care of the family, of their family, and it brings it all the way up towards a societal perspective where the Khalifa, the leader, the Imam of the who is taking care of his responsibility of providing for the subjects underneath him. So, you know, every one of us, whether you're a healthcare person, whether you're not, whether you're just a regular Joe Schmo, we have a responsibility. And we have a responsibility to, one, take Islam to our societies, as well as make sure that that Islam is within our homes, within our environments, and we are able to reflect on this, inshallah. Samir, do you want to add something to it?
No, I'm good.
Dr. Sharief?
No, I think you hit on the point.
Okay.
Yes, we have responsibility for ourselves, for our families, for our society in general. And yep, yeah, you hit on it.
Good.
I'll add something to it. I mean,
sure.
I think the important thing here is just because you think you're at home and you're not doing it, everyone has a responsibility. And I encourage everyone to look at what their responsibility may be and to find that and to implement it. That's basically what we're saying, that don't think that you have no worth in any of this stuff. Your responsibility may be that, let me stay away from my parents, and that's a huge sacrifice for you because that's what you're doing to take care of your family. The other thing you can do sitting at home is make sure, like as Rafi said, the majority of the US population, they live hand to mouth. If they don't get a paycheck, you know, every other week, they can't eat. So we need to not just sit there and just kind of like, oh, you know, I can't go to Jummah, I can't go to the masjid. Do what you can do. Like this is an opportunity. Maybe Allah subhanahu wa ta'ala opened the gates for you to go and see, finally meet your neighbor, finally find out what's happening in the community. If Allah subhanahu wa ta'ala provide you a certain amount of wealth that you were just sitting on, this is your opportunity to use that wealth. And, you know, a lot of people are trying to make money off of this thing. You know, we have to be the opposite. We have to be, you know, it's just, it's not just speak, you know, the healthcare workers are going to the front line, but everyone can do something, okay? Which is to try to look out for the community, support with your wealth, let these people know that who are hoarding toilet paper, that, hey, we're, you know, that we have a stinja, we can use toilet. I mean, whatever you can do, okay? So, you know, everyone can find something to do in this time. So saying bored, being bored doesn't make any sense to me. Saying
correct.
There's a lot of stuff you can do.
Before we take the questions and finally kind of hit our last topic, which is the healthcare system, I wanted to bring, sorry, yes.
Yeah, just a small addition. I agree, Samir. That was very helpful. Like, and also, inshallah, this thing is going to pass. All right? This thing is going to pass, and inshallah, majority will do well. So it would be a shame if we forget the lessons from this and go about with our lives after everything is over. You know, I mean, like the differences which societies have between each other, the differences within the family, between families, between nations, between whatever. Like, you know, as I think Winston Churchill or someone said, like, it's a common enemy which unites people. So as of now, yes, there is a common enemy which is uniting the nations. But if inshallah, this is going to pass. But if it would be a shame if everything goes back to what it was, you know, if there is nothing, if our lives don't improve on an individual level to a nation level after this, then the whole thing was futile.
Yeah. Before we go to our last topic, which is the healthcare system, I wanted to bring in a few things that we know from now this issue of the quarantine. This is something that Rasul Sallallahu Alaihi Wasallam himself spoke about. I think it's worthwhile for our audience to know about this, that Islam One, for example, I just want to make sure that we, Islam, when we talk about the health of people, we don't discriminate over Muslim, non-Muslim, what nation you're from, what tribe you're from, etc. That's not there. It is a responsibility of the state to take care of the people. Maybe for a later discussion, we can speak about the healthcare system in Islam later on. But I wanted to bring in a few hadith that talk about quarantine and what Rasul Sallallahu Alaihi Wasallam has mentioned about this. And I think it would be beneficial for our audience to know about it. Let me share my screen and we'll read off this. Can you guys see my screen?
Yes.
I think so, right? Okay. So if you see Rasul Sallallahu Alaihi Wasallam, he says, there's a collection of hadith that I brought up here. He says, the first hadith here, it says, if you heard of a plague in a land, then do not enter it. And if you are in a land and it enters to that particular land, then do not leave it. So the idea of quarantining yourself and quarantining the people in which the plague has existed, this is the concept that Rasul Sallallahu Alaihi Wasallam has actually spoke about, where you quarantine the infected area and do not let anybody enter it. And if it enters your land, if you're in that land where there is a plague, so in this case COVID, then you do not leave it so that you don't spread it, right? And Aisha radiallahu anha, she asked Rasul Sallallahu Alaihi Wasallam about the plague, and Rasul Sallallahu Alaihi Wasallam mentioned that it is a punishment that Allah sends upon whom He wills, and Allah made it a mercy for the believers, for there is no servant who encounters plague, but he stays patiently in his land, knowing that nothing will befall him except what Allah has written for him, except that there is for him a reward like that of a martyr. You die a death of shaheed, basically. So, I mean, the wording of this hadith is amazing for us, because it says Allah made it a mercy for the believers. Subhanallah, right? Rasul Sallallahu Alaihi Wasallam is switching the angle here. He said He's made it a mercy for the believers, for there is no servant who encounters plague, but he stays patiently within the restrictions that he has, knowing that what came to him is from Allah, and if he happens to die, he dies the death of shaheed, as a shaheed. I think we spoke about another hadith, la darara wa la dirar, that there must be no harm and no harming. So we don't harm other people. We have to be mindful of that, and we don't do any harm. And this is something where we know of as physicians as well. We don't need the Hippocratic Oath. We know this from our aqidah, from our Islam, that we have to be truthful and responsible for whom we care for. And then finally, in another hadith, do not put the sick with the healthy. It may sound so simple for us now, but this is what our teachings have been, of what Rasul Sallallahu Alaihi Wasallam taught us about how to keep oneself healthy and how to take quarantine measures and so forth. There's a lot of discussion about the healthcare system, how it can implement this and so on. But I'll leave it to that. Let me stop my share. All right, so let's take, let me see here. Let's take our final topic, which is the healthcare system. Because obviously there is a lot of pressure and talk about the American healthcare system being one of the worst in the nation, in the world. Let me read off a stat here. It says that, let me say, so it says every year about 530,000 Americans file for bankruptcy because of medical debt. And it says one out of every 6 Americans has an unpaid medical bill on their credit report, amounting to $81 billion in debt nationwide. I mean, these are insane numbers. So 500,000 people every year file for bankruptcy, a total debt of $81 billion of medical bills. So if the disease doesn't kill you, the bill will. And this is apart from the credit card bills people have, the mortgages that people have, the rent they have to pay. Like Sam was saying, Dr. Zaheerullah was saying that, paycheck to paycheck, Abdur-Rahman, what do you think about this healthcare system that we have?
I mean, there's
use a lot of proper words. Right?
I mean,
he's only getting paid a resident salary.
I'm only getting
No
that's another thing that we have to discuss here, because I don't qualify for hazard pay. So I mean, yeah, the healthcare system, it's if you look at how many people are actually getting admitted to the ICU, right? Let's just start there.
Yeah.
Right. Forget hospital admission. Forget an ED admission. If let's look at the big number where they end up. Right. ICU admission, and Samir, you can correct me if I'm wrong, can cost about 30 grand per day almost. It can, depending how sick these patients are. And these patients that are coming in are really sick. The second thing is these patients can't be taken off the ICU. Where can they go next? You know, like people have to go to rehab. People have to go to a nursing facility. People have to go to a skilled nursing facility, right? That is also something that the insurance, tag on to their medical bill. So you're looking at this disease for a medical bill that can be almost about 2 months. If your patient's really sick, the medical bill could be for 60 days, and that could be from a ED to the hospital, ICU to rehab, and then eventually home health care or home care,
physical therapy and recovery,
and whatnot,
medications.
And the amount of people that we're seeing now, the scary part is when this starts to trickle down, maybe like a year or 2 years, how many people are going to be in debt? And what's going to happen 2.5, 3 years down the line when people start defaulting their debts? So this can affect us down 5 years. This can have an impact that can, affect the economy and the healthcare system. Maybe in the next 3, 4, 5 years, we can see those effects. So what the healthcare system is right now is, I mean, I don't know all the details of it, but it's not pretty. It's not helping the patient holistically, and then it's also kind of a risk for the healthcare physicians and nurses and stuff.
Okay. I just wanted to hold you off for a second. I made an error in the hadith that I cited about the shaheed who. So I said if you die a death of shaheed. That's actually incorrect. It just means anybody who gets affected by the plague, regardless of him or her dying or not dying, you will still get the reward of a shaheed. Just wanted to clarify that error. Jazakallah khair. Okay, sorry to cut you off, Abdur-Rahman. I just want to make sure I don't leave out anything misrepresented, especially a hadith. Go ahead.
Yeah, so I think that's the only thing that I worry about. Like, how do you how do you manage this going forward? And it's a whole systemic issue that it's not going to be fixed overnight.
Okay, Dr. Zaheerullah.
So let's call it for what it is. We can talk about it in two aspects. Okay, one is the overall healthcare even before this crisis occurred.
Correct.
And two is what happened as a result of not having what we call centralized healthcare, and what that could have prevented. So let's talk about the first part, which is the more pertinent part for the coronavirus. So as you guys know, the Department of Health and Human Services is a cabinet level committee that's under the direct watch of the administration for all the executive branch. And then part of that umbrella is going to be CDC, Centers of Disease Control, which we're taking as the ruling body or the authority on the infectious disease. And then also as part of that is the FDA, which is the Federal Drug Administration. So, Food and Drug.
Food and Drug, yes.
So bottom line is, definitely there would have been a lot of positives in terms of if it was all centralized, not having this hodgepodge of recommendations here and there. The CDC gives a recommendation and it gives a lot of autonomy to a lot of institutions, health institutions, hospitals, to do certain things in a basic guideline, but there's nothing coming centrally, okay, in terms of these are the things that we must do. It's kind of left to the states, the hospitals, institutions. And the United States is set up that kind of way. And then obviously, when it's set up that way, and you have a corrupt administration, and people looking out for their own self-interest and worrying about the economy more, things like that, you're going to get the CDC is going to be influenced, and the FDA is going to be influenced. So, not having that trust is a huge part. And I realized that, like, let me give you one example. Okay, the one example that I know that there's hodgepodging going around is because CDC eventually first came out with a guideline when it was first happening earlier on, that, hey, that you need to wear N95 masks for all patients who are suspicious of this, okay? And N95, which is a respirator that filters particulate matter up to the 95 size or something. So basically, that's what they were recommending, and that was a strong recommendation. Then when things started getting chaotic and they realized that this is not going to be sustainable, they all of a sudden, literally, this was in their guidelines saying that if you have scarves and bandanas, you can wear that and not wear N95. So that doesn't make any sense. And then people are scrambling, what can we do? So they're not looking out, for you, in terms of that. That's the case. I mean, they're basically getting their information from the executive branch, and that's kind of a problem. If it was like a centralized government, like say China and South Korea, if you look at South Korea's example, it's amazing what they did. They did testing early. They learned from previous SARS epidemic how to do the testing and how to implement that. The first case in South Korea was recognized at the same date that the US was. And you can see what happened to them, and you can see what's happening to us.
That's interesting. I didn't know that. Yeah.
They had the first case. This was, I'll tell you exactly when it was.
This is March 14th.
January 20th, first case in the US, okay, which was in Washington, and South Korea had its first reported case. Obviously, this is reported. People probably had it earlier before that. But they were able to do strict implementation. They ran tests like 10,000 per day when we didn't get to 10,000 tests in like 2 weeks. So obviously our numbers are going to be way worse than theirs, okay? And their number of new cases, they tested everyone. Anyone who was sneezing, anyone who had fever, and that's how they got a control of it. So bottom line is that was the downside of not having a centralized healthcare system. Okay, that's for this case, for the COVID case. Now in general, what do I see? Well, I see, bottom line is the US is trending more and more towards that, okay? That having a centralized healthcare. If you look 20 years ago, you couldn't even survive politically if you had that kind of belief. It was a very minority. So it's getting more and more mainstream that this concept is there, and it eventually will come. There's going to be some battles, and there's resistance and so on and so forth. But that will eventually come. People have the argument that, hey, the downside is if you have a centralized government, the innovation in healthcare, the type of healthcare that you can get, things like that, things will get delayed. There's downsides to both. But let's just be honest, the way that the healthcare is set up here, okay, it's basically you get excellent healthcare if you are in a certain class, period. If you're not part of a certain class, you're gonna have horrible effects. Not only the healthcare that you're getting, but then in terms of the repercussion of the debt you'll be set back, the coverage, the stats are all there. If you're a Black and African American woman, your rate of childhood in labor to die is exponentially higher than somebody who is white of that same age group. So we already know that that's the case. So that has to balance out. Obviously, we don't want certain, our healthcare to be affected, the innovation, but that can be done both ways. So that's just it'll happen eventually, but just, we're going to have to wait for the right administration to be in place for that to happen. Can you hear me? I'm done.
You muted yourself.
Yeah, you muted yourself, Rafi. Unmute yourself.
There you go. Yeah. Dr. Sharief, last words, please.
No, I mean, it's the issues are a lot. Okay. Healthcare, the current healthcare, as well as whatever any political party or any political candidate is suggesting, there is no quick fix to it. It needs a big overhaul. It needs a big overhaul. Unfortunately, there is a lot of lobbying which goes on. The hospital administration has its lobby in Congress. The insurance system has a lobbying. It's not a perfect system. Every system everywhere in the world has flaws, but it needs a change, no doubt about it. Okay. It needs a change in which patients are kept first, as well as there should be some bit more transparency. And it is what it is.
Inshallah. I think it's worth doing a separate talk on this completely because there's a lot to discuss about the healthcare system. But let's just move, I'm going to, inshallah, try and end the session. But I want to make sure that I get the last few questions so that we don't leave anybody hanging. So there's a question about, and we'll end with this, inshallah, with a few questions. The question about black seed, chloroquine, and hydrochloroquine. We take the hadith as is about the benefits of black seed. Is there any evidence to support that black seed has chloroquine or hydroxychloroquine? If so, do people have cause to believe in the benefit of using chloroquine or hydroxychloroquine in preventing infection? Who wants to jump in on this? Dr. Sharief or?
Yeah, I can. I mean, like,
yeah.
Look, anything which the Prophet ﷺ said is true. I mean, it's true.
Yes.
The black seed as well as honey, of course, they have shifa, and alhamdulillah, people should use it.
Outside main lobby, all blue.
All right. Okay.
Yeah.
There was a code. So Abdur-Rahman is out. All right. Go ahead, Dr. Sharief.
So in terms of if Prophet ﷺ has mentioned it, definitely yes. it has a value to it, and people should use it. Along that lines, honey also. In terms of hydroxychloroquine, so basically what happens is it's a disease which causes a problem, but at the same time, it's our body's response to it which also causes extra problems. So basically, when people inhale the virus or contract the virus, the body responds with inflammation, which causes ARDS, respiratory failure, and all those things. Mm-hmm. So hydroxychloroquine, it's not like it kills the virus. It does not kill the virus. It's basically, it has immunomodulatory effect in which it kind of cools down. It's basically like steroid, but it kind of cools down the body's response to the inflammation. And yes, we are using it. And from the data coming from China and Italy has been encouraging. So yes, I have a lot of patients on it, and alhamdulillah, as of now, it's hard to say what we are doing is mirroring the results which was shown in Italian and Chinese studies, but alhamdulillah, it is working. Yeah. Okay. So it's hard to say, is it just the natural course of the disease process, or was it because of hydroxychloroquine? Yes, at the same time, yes, there are people while on it who are still crashing, but there are people who on it are also doing better. Of course, months down the line, when we review all the data, only then we can say for sure. But alhamdulillah, we are using it, and the supply is there. It's not that people are going to run out of it.
I think the person asking the question was implying that there may be a chemical similarity between hydroxychloroquine and black seed. I don't know about that.
Neither do I.
I'm not a pharmacist. But just to add something about the hydroxychloroquine is that remember, it's not what Trump said it was. No way. In case we're using it because we have. You guys have to understand, we have nothing for this disease. So we're throwing things on it that has less harm, but hydroxychloroquine is not without side effects. When we put these patients on this drug, we're putting other drugs on that can have effects on the heart, things like that. We have, and the liver specifically, we're monitoring that, so just don't start taking it if you have access to this medication. I don't recommend it, not prophylactically. We're using it in a very controlled setting. There's a person that died taking some sort of aquarium medication based off of Trump's information that has hydroxychloroquine in it, and that person took it and died. And his wife also took it and got sick. So don't start taking things without talking to your doctor. Yeah. There's no recommended medications to be taking unless you're in the hospital under a doctor's care.
All right, let me take one question here.
Just a second. Okay. Yeah, I totally agree, Samir. I mean, you brought up a nice point. I mean, I have been asked by several at workplace, as well as from fellow physicians, as well as from my friend circle, about taking something as prophylaxis. Please don't take it. It has its own side effects. When we use it in the hospital, it's under close monitored setting. And there are a lot of things which we monitor for when we use it. I mean, there is no reason, there is no prophylaxis.
Jazakallah khair. This is from Bisma Fatima. Have you guys been faced with any geriatric patients who have COVID and dementia with behaviors? If so, what are the interventions in those cases? Very specific question. Have you guys had an experience with this?
Oh, I'm not sure exactly what the question is asking.
The question is asking if there's a COVID patient who also has dementia, and how do you guys deal with this now?
So look, if the patient is coming with COVID to the ICU, they're usually pretty sick. Okay, so, dementia makes it a little bit more difficult for them to take care of. There's no link between COVID causing dementia.
No, I don't think that's what's intended to be asked.
Okay.
It's just if they have the comorbidity of dementia.
So it's just like any other illness. We deal with dementia patients all the time that come in for various different types of illness. It becomes a little bit more difficult to manage them because they can't follow instructions and so on and so forth. But the healthcare system is, the nurses, the doctors are well equipped to handle patients that have dementia. If we need to give them some medication for them to become a little bit more respondent, a little bit more cooperative, we can do that. And if they're sick enough that they're coming to the ICU, most of the time their dementia is not really playing a role in them being not cooperative. They're so sick that they're kind of sleepy and what we call obtunded. So
okay. There's a comment from Mohammad. He says Western countries gave up their responsibility for basic needs such as health by privatizing them and leaving them to commodity subject to the forces of commercial market. Excellent comment, and I think most of us will agree to that healthcare is essentially a for-profit industry for the major corporations, and that requires a whole different session altogether. And I think it would be advisable that we do something on the healthcare system in general. Let me end with this last question, and I think it's a good point to end on. It's from iPad 3. What are the major symptoms one has to look for before admitting in the hospital? The session has been very informative. May Allah keep all people safe. Ameen. Jazakallah khairan. Jazakallah for the question. We did discuss this, but I think let's refresh this so that everybody is aware of this. Dr. Sharief, I'll let you get the final word on this.
If someone is feeling sick, it's basically like flu-like illness. If someone has a cough, fever, body aches, the travel history is kind of irrelevant at this time. Like several of the patients, a good percentage of the patients which you are seeing in Indianapolis have had no contact with anyone as well as they haven't traveled. So don't worry about the travel history. But if you're feeling anything like a flu-like symptom, which is basically cough, fever, body aches, myalgias, and those things, yeah, definitely get yourself checked out. And at ER, they will make a decision if that person needs to be admitted or not. And basically the point of entry is the ER. And the things which ER usually looks for is basically how sick you are in terms of the examination findings, some lab monitoring, your X-ray, as well as how much are you saturating, how much, like we have something called as a pulse ox of our body's oxygen percentage. So the ER would be the one to decide, depending upon all those things, if that person needs to be admitted or not. But yeah, that's
I have to intervene on that. So I'm going to somewhat disagree with Dr. Sharief.
Oh no. So listen, man, I thought this.
No, he's right about the symptoms. Yeah. So if you want to recognize the symptoms, okay, it's going to be exactly like flu. Okay. The coughing is usually dry. You can't have a fever. Most patients we're seeing have fever. The rest of the stuff is all stuff that we'll see on labs. But in terms of, it just basically feels like a truck has hit you. So what I would say is that do not come to the ER at all, okay? The only time you should come to the ER, if you're having symptoms like a flu-like, you don't come to the hospital for flu-like symptoms, do you?
Correct.
So I want you to basically, if you're having any kind of flu-like symptoms, stay at home, stay away from people, wear a mask. If you're gonna encounter somebody that's gonna help you, quarantine yourself. Drink a lot of fluids. There's no cure to this. It's just basically, fluids, things like that, making sure you're staying away from people, making sure you have hand hygiene. And if you're doing, what I would say to seek extra help, now when you're sick like this, you can try to get tested if you can, and that you should call your primary care physician, see if there's any way you could get tested. The testing will help you to see, hey, do you have it or not? And do you have, to kind of give you some peace of mind. And if you don't get tested, it's okay. Just stay calm and just stay at home. I would say seek extra
But let your
help.
Physician know
Correct.
that you're having these issues.
You got it.
And we monitor you on a regular basis.
They'll tell you monitor your fever, monitor for other symptoms. I would say you got to start seeking help when you start feeling somewhat short of breath. It's not normal for you to be short of breath, okay? If you start feeling short of breath, it's not going to happen. You're not going to get sick all of a sudden. What's going to happen is you're going to start feeling maybe like some chest tightness, some difficulty catching your breath. And this happens to not the majority of patients, okay? That's why I don't want anyone who has just a flu symptom just to come to the hospital, because one, you're exposing yourself to unnecessary risk, and two, you're going to inundate the hospital ER. When the ERs right now are I've never seen them as busy. There's patients lined up outside. These are really sick patients that are coming in. So what I would say is that if you're feeling respiratory symptoms, not cough, if you're feeling respiratory symptoms that involve shortness of breath, difficulty catching your breath, or if somebody's taking a look at you and they look like, hey, you're breathing like in the 30s, you know, like, and even if you don't feel it, then I would say that's when you seek going to maybe urgent care or ER at that point. Otherwise, it's probably better for you to stay at home, even with flu-like symptoms, because you're likely going to recover. I don't know if you disagree with my assessment.
No, I agree. I just gave a shorter version of it. But yeah, if person is not feeling the shortness of breath, they shouldn't come.
No.
But if they have a slight hesitance, if they have a slight doubt that their breathing is, if every person knows their body better than anyone, right? If you feel that you are not catching your breath as much as you usually do, then definitely seek help.
Not due to anxiety though, because the anxiety of this illness.
At the same time,
I'm saying like really like, you know, you should have respiratory symptoms.
Yeah.
Yeah, I mean, be careful. Right.
I have consulted a lot of friends who are basically feeling short of breath just from anxiety and panic. Of course, they shouldn't be coming to the hospital. Even a shortness of breath depends from person to person. If someone is just very anxious and panicked because of this, then those are not the patients who should come to the hospital. But yeah, compared to your routine, if you are feeling short of breath, then definitely you should seek help.
Yeah.
But then people shouldn't come to the hospital just because, hey, I may have seen someone who was positive. Even if they did get in contact with person who was confirmed positive, and they shouldn't come to the hospital. Yeah, it's about balance. It's about balance. So one should have the same kind of a benchmark to come to the hospital before this thing started, you know? Like, yes, if you are not, like just because of this, that shouldn't throw people into a panic mode to come to the hospital. Consider your life before this. So do the same thing as you would have done before this thing ever started. And use that as a benchmark to come to the hospital.
Jazakallah khairan. We'll inshallah end here. Jazakallah khairan for all of our doctors that came by. I want to give, recognize Dr. Abdur-Rahman, who had to leave, Dr. Zaheerullah, Jazakallah khair, Dr. Sharief, Jazakallah khair as well. Thank you for all of your beneficial advice and talks and so forth. I would like to thank all the audience members that have joined us and have asked questions. Jazakallah khair for listening to us, and may Allah accept this as part of everyone's ibadat that we started with the name of Allah subhanahu wa ta'ala. We spoke about Allah subhanahu wa ta'ala during this session, and we will inshallah end with the name of Allah subhanahu wa ta'ala. Wa akhir da'wana anil hamdulillahi rabbil alameen. Inshallah, be safe and keep us all in your du'as. May Allah azza wa jal protect us all. May Allah azza wa jal keep us close to Him. May Allah azza wa jal accept our deeds. May Allah azza wa jal forgive our sins and allow us to enter in His Jannah with His mercy. Inshallah Rabbil Alameen. Jazakumullahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.